Hi, Dr. Gullberg here, continuing our internal medicine lecture series. Today we're talking about anxiety in the outpatient setting as well as insomnia, as they frequently go hand in hand. Number one, it's important to use a quantification score. I like to use the Hamilton Anxiety Score for objective testing in the office setting. Obviously, people need counseling for this if it gets out of hand, to sort out the different types of stressors and different types of anxiety reactions that are obviously mild to sometimes extremely severe and serious. So don't be afraid to certainly get counseling for your patients. Medication treatments have been revolutionized over the last 20 years. I think the SSRIs have been very effective for a lot of these problems. These include Prozac, Zoloft, Lexapro, Paxil, and Celexa. Previous to this, in the past, tricyclics such as tofranil, anafranil, have been used. They don't work as well for when OCD is related to the anxiety. High-potency benzodiazepines such as clonazepam, lorazepam, alprazolam are most commonly used today. We like to use these for short-term basis only because of their addictive potential. Buspirone has been around now for many years. Is also a good med for anxiety, but it takes about 2 weeks to get an effect, and it must be scheduled. Very good for PMS, anxiety, and insomnia. Sometimes you need to add beta blockers to combat the physiological effects of anxiety. Now we talk about insomnia. Obviously the common causes of insomnia are stress, lack of exercise, too much caffeine, hormonal changes, excess anxiety. Sometimes physiological issues need to be resolved, especially if somebody has hyperthyroidism, that type of thing. The SSRIs can also be an issue with sleep disturbance, so you got to watch that. Our patients like to go with herbals sometimes as they combat insomnia. There's several of them out there that have been utilized, including theanine, tryptophan, valerian root, passion flower, skullcap flower, hops flower. You can use vitamin B6, you can use melatonin, several agents that are over the counter that can be helpful. Sometimes just using over-the-counter Benadryl or Tylenol PM can be effective. Prescription meds tend to go into the benzodiazepam class, such as flurazepam, quazepam, temazepam, and trizolam. Those are the most common benzos that are used. The non-benzo agents include Lunesta, Ambien, Sonata, and Rosarum, which all can be effective, but again, short-term use is the key here, and not using these agents long-term. Longer-term use, we can use agents like trazodone, which I find to be very effective in people who have no benefit from these other meds. Probably the most important thing is sleep hygiene. Regular bedtime, avoiding long naps, cool, quiet, dark environment, relaxing bedtime routine, avoiding caffeine late, avoiding heavy meals late, reduce fluid intake late, regular exercise, hot bath before bedtime, and avoiding alcohol and nicotine before bedtime. These are all very helpful when combating insomnia. So just a word on anxiety and insomnia. Hopefully this will help you as you treat patients in the outpatient setting. Thanks, Dr. Gullberg, signing off.